So I think we all know how awful, bloated, overpriced, and inefficient America's healthcare system is. It's a widely discussed issue with various solutions being proposed over the years. Some end up being implemented and marginally improving the system, others get scrapped or have little to no effect on making healthcare more affordable for the average person. And it is commonly believed that America has never attempted to fully cut out the middleman and nationalize the whole thing like basically every other developed country has done. But this is not entirely true. Enter the Green Mountain State, home of Bernie Sanders, ski resorts, and a surprisingly progressive public. They have a high minimum wage, they're willing to vote people into office even if they don't belong to either of the two major parties, and notably, most of Vermont's residents use non-profit health insurance. So it was really no surprise when in 2011, they became the first state to pass legislation allowing for a statewide, tax-funded public healthcare system to be set up. But unfortunately, the plan never actually materialized, and within just a few years, Vermont's officials had completely abandoned the dream of single-payer healthcare in their state. So what happened? When Vermont's governor at the time, Peter Shumlin, signed off on the bill that would lay the framework for such a system, it received a lot of positive press and approval from the general public. The legislators themselves said they had a lot of faith in making this thing work. But in their flurry of excitement about this new healthcare project, they forgot to ask themselves a very important question. How are they going to pay for it? The thing is that healthcare systems in general are incredibly expensive to maintain. The way that health insurance companies have so much money to pay out clients is because they have millions of people paying for one of their insurance plans every month to receive coverage. This gives these companies a giant pool of money from which they can take whenever they need to pay for someone's doctor visit or surgery. Of course, that's assuming they actually agree to pay for your doctor visit or surgery, because a lot of times they don't, and that's one of the big disadvantages of such a system compared to one funded by the government. But even in countries that have nationalized healthcare, paying for it is not a cheap endeavor. Typically, the governments of those countries have to spend hundreds of billions of dollars annually to cover the medical costs of their population. Now, for those countries, it's a worthwhile expense because the whole population pays for it, meaning each individual only has to contribute a small amount as part of their tax bill. But the government still needs to have the money to afford that expense. And that's where Vermont ran into problems. See, they had about $2.7 billion available for this program, but most analysts at the time predicted that they would need another $2.5 billion to make it feasible, which is nearly double the amount, so you can imagine how that might complicate things. And further estimates predicted that the cost would only go up as the years went on. The thing is that states are not countries. While they receive enough taxpayer money to maintain public infrastructure and maybe fund small projects here and there, they generally do not receive as much money from their population as a country does, and certainly not enough for a public healthcare system. Now, yes, theoretically they could have doubled their income tax rate to cover the cost, and maybe it would still be cheaper for the end user compared to buying health insurance, but that's never been tested on the state level, and they weren't willing to risk such a huge tax hike just to find out. And it seemed that at every corner there were things adding to the cost of the project and weakening their ability to secure funds for it. Employers that already paid for health insurance wanted an exemption from the tax hikes. The federal government didn't offer many funds for the project, and a lot of them couldn't be provided until several years later because of various laws and regulations. There's also the fact that in America, medical costs in general are overinflated due to a lack of price caps, which made the required budget higher than necessary. As more of these issues began to surface, it started to become clear that creating a system in Vermont where nobody needed to pay for health insurance anymore and could instead rely on the state to cover their medical costs was simply not going to work out, which is why on December 17, 2014, after several years of failed proposals and unsuccessful negotiations, Governor Shumlin officially decided it was time to pull the plug. But do not worry, this does not mean that nationalized, or at the very least universal healthcare is impossible to achieve in America. Ideally, these kind of things are best handled by the federal government. As I said before, they have the money for it, and they have the ability to lift whatever roadblocks may stand in the way. Assuming they do that, it may even be possible for states to implement tax-funded healthcare before it's done nationwide. Even though it didn't work out in Vermont in 2011, it could work out for them in other states in the future if they are given the right conditions for it, which the federal government can definitely help with. Of course, you will also have to explain to people how a nationalized healthcare system works, how it's basically like having one giant health insurance company that the whole country contributes to, making the cost cheaper per person because it's not for profit, there's less paperwork involved, and there's objectively more contributors than a private health insurance company would have. And you can explain to people that the small tax hike they'll experience is basically the new way of paying for health insurance, a way which is cheaper and will save you money. There are many different ways to go about it. After all, no two nationalized healthcare systems are alike. But if other countries were able to do it, and were able to do it successfully, I'm sure we can do it as well. And that was the end of this video, guys. I hope you enjoyed it. If you did enjoy it, please do consider hitting that like and subscribe button. As always, this was your captain speaking, and I'll see you later.